Yes, we dey live, very much alive, okay, on top the channel, talking about your #1 family entertainment channel. And traditionally, now our Saturday, they always carry our say just immediately after the breakfast show, where they share from 7 to 8. Dr. Barth and my able self, unless otherwise, always they here from 8:30 to 9:30 to carry you guys through the journey of health. I mean, health is wealth. You know, if you get good money, you know, if you live a good life, if you know get good health, proper health care. All right, and that's now why Dr. Barth is there with us every Saturday. We started something 2 weeks ago, I think, you know, talking about malaria vaccine alongside COVID-19. As a matter of fact, I think it's safe to say, should I call it a third wave, you know, doctor? Because I don't even want to talk about the Delta variant yet. I just want to talk about the increase in numbers so we don't start the experience again from the hospital. But ladies and gentlemen, I am sure Dr. Barth will be able to touch a part of that this morning. Join me as I welcome my able doctor, always looking fresh. The only sagalicious doctor I know.
Good morning.
Good to have you again.
I'm pleased to be back.
Same here.
Yeah.
I mean,
I can see you're doing very well.
Thank you.
As
Thank
always.
you very much, sir.
Yeah. Good morning, viewers at home and around the world. This morning, we'll be looking at a topic we started some 2 weeks ago. Malaria and malaria vaccine in the background of COVID-19 pandemic. The truth of the matter is that COVID has dominated headlines in the media for about 2 years now. And of course, it has made us to lose sight of some of the challenging health situation, public health situations we have in this part of the world. Talking about Africa, someone said that COVID-19 probably, malaria kills about 4 times the number of people that COVID-19 has killed in the last 1 year. And I took time to look at the figures. And truly, it was something close to that. In 2019, according to WHO figures, it was estimated that malaria killed about 229 million persons across the globe. Killed about 229 persons, or affected about 229 persons, not killed, I beg your pardon, and of course, causing about 409,000 deaths in just 2019. I tried to look at the affectation of COVID-19 in African sub-region in the last 1 year. My source is Worldometer. And of course, I discovered that the total cases or the number of people that have been so far infected, of course, this includes people that have recovered as well as people that unfortunately did not recover. Okay, so in the last, or since COVID began, it has affected in African sub-region 6,729,769 persons. And it has caused total deaths amounting to 169,666. Meaning that it has killed approximately about 170,000 persons across Africa. Suffice also point out that the total number of people who have recovered was also as close as the number of people affected, 5,874,379 individuals. That is not to say that COVID-19 pandemic is not the deadly disease we have known it to be. Keep in mind that we are beginning to see third wave. We are beginning to see a resurgence in the number of affectation in African sub-region. All as a result of the Delta variant strain that is beginning to cause havoc across the globe, affecting both vaccinated and unvaccinated individuals. But however, not in the same proportion. I must be quick to point out that In the coming weeks, we'll be able to go back to COVID-19 and give an update of where the world stands at the moment. But this morning, our focus will still be on malaria, as well as the efforts that the scientific community has made, okay, in the discovery of malaria vaccines. Malaria, as we all know, is a life-threatening disease that is caused by a parasite or a group of parasites, which are transmitted to humans through a number of means, predominantly through mosquito bites. And when we talk about mosquito bites, we are talking about female Anopheles. Infected female Anopheles mosquito. Why is it always female? Okay, don't let us go there.
Doctor, we are
Don't
not
let us
going
go
there.
there. Don't let us go there. And of course, a number of species, as we did say last week, okay, have been found to cause disease in human. There are about 5 of them: Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, and of course, Plasmodium knowlesi. These are the 5 groups of parasites that are known to cause diseases in humans. According to WHO figures, nearly half of the world's population are affected by malaria. And of course, some school of thought actually believed that malaria has killed more than half of the humans that have ever lived. So it is, of course, a major health threat. And when we hear about vaccine, malaria vaccine, all eyes should truly be on such emerging news. Okay? Why is this so? Getting a vaccine for malaria has been a holy grail that has taken the scientific community about 114 years. 1907 precisely was when they started making effort to see if they could get a malaria vaccine. Getting a vaccine for parasites was very challenging and complex, unlike it was with viruses and bacteria. But of course, the good news is that a good number of vaccines have gotten to advanced stage. And of course, one has been approved and is currently in use in a pilot scheme that is being carried out in about 3 African countries, namely Ghana, Kenya, and Malawi. And as a result of this, they've been able to vaccinate about 650,000, over 650,000 children, giving out about 1.7 million doses. Of course, every child within a certain age group, 5 months, 5 weeks to 36 or thereabout, okay, in countries where the pilot scheme is ongoing at the moment, is expected to receive at least 3 jabs with a booster dose, making it 4. But this can only prevent the infection only to a limited degree, not up to 50%. So there is still a lot of ground to be covered. But the good news also is that about 2 pharmaceutical giants have actually made some breakthrough. And I would like to point out that the same AstraZeneca, Oxford, that has been responsible for the major COVID-19 vaccine that is being used in Nigeria today is also in the forefront. As a matter of fact, they started making attempts to get a malaria vaccine before even that of COVID started. And today, they have a vaccine that have gone past the early stages, has gotten to an advanced stage. At the moment, a trial is ongoing in about 4 African countries. That a large number of patients are involved. Over 4,800 patients are being tried. And of course, with promising results, the vaccine is said to have about 77 efficacious rate in comparison to the one that have been in existence before then. There's also another one, of course, the one that has been in use that I said has gotten approval is the only approved one as we speak in 2021. That is the RTS-S, which has a brand name Mosquirix, from mosquito, probably, Mosquirix. Okay, and of course, R21 is the one from the stable of Oxford AstraZeneca. And of course, they are doing it in combination with SII, Serum Institute in India, okay, alongside another biotech company in the US. The third vaccine that is also coming out with some promising results is the one being put together by Sanaria Inc. is a biotechnology company in the US. This particular vaccine, the third one, is unlike the two previous ones that I've mentioned, which actually make use of protein particle of the parasite. Okay, but this particular one combines attenuated live parasites given alongside malaria medication to individuals, and it's said to in the few number of people that it has been tried, that the trials have been conducted, it gave about 100% effectiveness rate. And of course, if that can be done on a large scale, that will be a major game changer in the fight against malaria. I also want to point out that the last 2 decades was regarded as the golden era in the fight against malaria. But all the grounds gained in the past 2 decades are beginning to be lost as a result of a number of things that are stalling in a number of countries, one of which is the coming of COVID-19 pandemic, which has disrupted healthcare system and of course health supplies and a number of things across the globe, not just Africa. And that is the reason why we are trying to bring these challenges that are being posed by malaria, particularly to African sub-region, so that we don't lose sight of the fact that yes, COVID is here with us. We must channel all energy. We must do all that are necessary to combat it. Present ourselves for vaccination, and take other measures, necessary measures. But at the same time, we must equally not lose track that we have an age-long public health threat or disease that has killed even a lot more than COVID has done since it began. And how is malaria transmitted from one individual to another? What are the symptoms? How is the diagnosis made? Okay, what are the preventive measures or methods of prevention, and of course the treatment?
All right, so we'll open our phone lines right about now. If you get questions, you get contributions to make on top the show, get into it, you want to know about malaria. Maybe you be one person, maybe say for 1 month, I've had situations like that, where person will tell me, say, still me 1 month, I treat malaria like 3 times. In short, some people believe say malaria no they go, say now forever sickness. No matter how you treat them, they feel say you go always come back. You know, just call us, tell us your experience, share experiences with us. On top those numbers video on your screen, 08173147589, and of course 08105434984, just as Dr. Barth could continue for where we stop. But yes, doctor, I be initially waiting, I be one ask, and I say she malaria na black man sickness, but later I can't change them. Okay, she na African sickness. What am I asking? Yes, because I think we actually talked about this 2 weeks ago when I talked, say why be say malaria they affect more of the blacks than the white, and does it have to do with color or does it have to do with the weather?
Thank you very much for that question. But before I go to your question, I would like to give credit to whom credits are due.
Okay.
Okay. WHO and partners for the materials we have used. Many thanks to them. And all other bodies that we have used their materials in the course of the presentation. We acknowledge.
Yes, so thank you.
And of course, give you due credits for that. Okay, so that said, is malaria an African problem? The answer is no. It's not an African problem. I remember a few years ago when I had to spend some few weeks in India.
Okay.
I was beaten and beaten badly by mosquitoes in that part of the world. So mosquitoes can be found in the tropics. I think certain areas of the equator that have common climatic conditions, not necessarily the African continent alone. Okay, but what is true is that the African sub-region, African WHO sub-region, have disproportionately high burden of malaria. WHO African sub-region is said to be home to 94% of all malaria cases and deaths. So it's dealing with Africa more than any other part of the world. That said, I also would like to point out that a particular parasite species is actually responsible for all of this menace that malaria is doing in the African sub-region. Talking about the P. falciparum that causes about 97.3% of all malaria in this part of the world. And it has taken time, 114 years since 1907, scientific community has been making good efforts to get a vaccine. And we are beginning to see some arrays of light at the end of a very dark tunnel. Okay, and we are hoping that in the coming months to years, we'll have a malaria vaccine that can be used
because I don't want to
for the general population, not just for children.
I don't want to sound repetitive because I know say during COVID I've been asked, say, okay, why does it take so much time for us to get a vaccine?
For malaria?
Yeah, no, for vaccine for COVID. Because now, and they were quick enough to at least give us the type of vaccines we get now. Now, malaria don't dey on ground, Dr. Barth, way before COVID. Yes, like you said, I think in 1970, I don't know, but I heard when you mentioned the date. So now I'm asking, why is it taking them like forever to get a vaccine? With the fact say we know say malaria kills faster than COVID and all of that. So why can't they just give it, if they could give COVID this, such an attention, why can't we have same attention for malaria that kills even faster and has even killed more than COVID?
I won't shy away from the fact that you've made some very key points in your submission. But I won't start from there. I will look at the other scientific parameters, okay, that may have made it difficult for a vaccine to be gotten for malaria since all those years, okay? One of the reasons is the fact that the genetic composition of the parasite is said to be in thousands, unlike that of
COVID.
Yes, for the parasite, it's said to be in thousands. So it has a very complex genetic formation in comparison to that of viruses with respect to COVID that are in dozens. Okay, so that is a scientific reason that have been alluded. Additionally, too, lack of proper funding has also not helped matters. Okay, the pharmaceutical companies that have been involved in the search for malaria vaccine, they are not as robustly funded as we saw with the pharma companies that were heavily funded by a number of countries of the world to get a vaccine for COVID. So I think those are the major reasons, okay? But not that these companies haven't put in good efforts, but the funding has not been anything close to what we saw with respect to COVID-19 vaccine breakthrough, okay? Now, that said, I want to go back to the advice that the WHO Director General gave. He said countries should do both. Countries should make effort to prevent both COVID and malaria, particularly in African sub-region, where we're having it worse than any other region. Okay, we must listen to their voices and, of course, heed their calls. Okay, and that calls are ours, not theirs.
Abi Henry from Lagos. Henry, good morning.
Good morning.
How are you doing today?
Glory be to God. I thank God.
All right, please go on.
Good
Doctor
morning,
is here.
Henry.
Yeah, I want to speak with that doctor in the screen.
Yes, he's
Thank you
here.
very much.
Go on.
Okay. I have this sugar issue. Hello?
I'm with you. Go ahead.
Okay. I have this sugar issue. So, which is the actual drug I will use for it? That if it can go finally.
By sugar issue, I believe you're talking about diabetes, sir. Am I correct?
Yes, yes.
Okay. The technical team will display my contact. So at the end of the program, you can give me a call, because in trying to answer your question in the public, I may break some of the rules of engagement here. So do call me after the show, and we'll talk more on that, sir. There are quite a number of them.
Yeah.
Thank you, sir. Thank you for calling. Okay, so back to where we left it.
We're talking about the World
Yes,
Health Organization.
yes. Okay, yes. That's my contact.
Yes.
You can reach me at the end of the program, so we can talk more, sir. Now, how is malaria transmitted? When we talk about malaria transmission, oftentimes we focus on mosquito bites and mosquito bites alone. Okay, losing sight of the fact that malaria could be passed from a pregnant woman to her unborn child. Congenital malaria, in what is known as vertical transmission, that can happen as well. So other than getting bitten from infected female Anopheles mosquitoes, malaria too can be gotten from other routes, which of course include transmission or transfusion of contaminated blood and blood products that can equally give rise to malaria infection to an individual who probably did not have it before. Okay, sharing of sharp objects by some individual, as can be found in people who abuse drugs, that can equally be a route through which someone can get malaria. And of course, transplantation of organs that may be contaminated. Okay, now this, having talked about this, I want to quickly talk about what goes on in the human body when we get bitten by mosquitoes, especially particularly the female Anopheles mosquitoes that transmit malaria. Now, what happens is that there are two halves of the life cycle of those parasites. One half takes place in the human body, while the second half takes place in the belly of the mosquitoes. Okay, so what happens is that when we get bitten by an infected mosquito, when a human being gets bitten by an infected mosquito, of course they bite other animals. We said that last week. Okay, so this parasite gets into our bloodstream and of course goes to the liver cells, affects the red blood cells. In some situations, the affectation of the red blood cells will make the red blood cells to clog up with each other. Okay, now when that happens, the clogging up will cause, will increase the viscosity of the blood, obviously, and of course it will be difficult for the blood to be able to navigate through the small vessels in the bodies that are called arterioles. So when that happens, usually found inside of some organs. So when that happens, it can bring about organ damage. So that is why you discover that people who have malaria and leave it untreated, it could go ahead and damage our organs. Pius from Kaduna. Good morning, sir.
Good morning, doctor.
Good to see you.
Thank you. Happy meeting you today.
Thank you very much. How is Kaduna today, sir?
Kaduna is fine.
Thank you. Happy to hear that.
For you, how can you differentiate between malaria, active malaria, and active typhoid fever? Is it through vomiting or what? More explanation, sir, please. Thank you.
Thank you very much. Thank you very much for that very important question. Key question. how can you differentiate in
Malaria.
terms of symptoms now, without the benefit of carrying out lab tests? How can you differentiate between malaria and typhoid? Now, the truth of the matter is that they share similar symptoms. They share similar symptoms, okay? But we're looking at the differences. What are these symptoms? Someone who is infected with malaria can have a number of symptoms. It could be GIT symptoms or GI symptoms, in which case such a person could have nausea, vomiting, abdominal pains, as well as stooling. Okay, these are GI symptoms that can occur. Someone with malaria too can have fever. Okay, when we talk about fever, we're talking about elevation of the body temperature beyond what is normal. Okay, apart from fever, there could be body aches, there could be headache. Okay, beyond all of this, like I said before the question came in, if left untreated, it could go as far as causing some challenges, usually in the brain, even in the lungs and some other organs of the body, okay, can be affected. But what would differentiate in terms of symptoms now, malaria with typhoid, is the fever pattern. Okay, in malaria, we have what the doctors will refer to as swinging pyrexia. Pyrexia is also another word for fever. What that means is that the fever comes up. The temperature comes up, usually evening periods or night. And with or without treatment, by the next day, in the morning, you're feeling better. Towards evening again, the fever spikes up again. Okay, so the fever shows up again. So that's swinging pyrexia. It goes, comes back, leaves, comes back, with or without treatment. But that is not the fever pattern you have in typhoid. The fever pattern in typhoid comes in a step ladder approach. It keeps climbing. It keeps climbing.
Come down.
It doesn't come down. So someone may have fever all through the day, all through the second day, even when treatment is initiated, that fever could still continue. Also, the headache could also be
constant headache.
Yes, can actually give it out. Okay, so the person may also have severe headache. These are one of the few symptoms.
Doctor, is it possible to have the two? You
Yes,
know,
you
because
can
in this
have-
part
you
we
can
say
have
you
the
have
two.
malaria and typhoid. That's like our what do you have? I have malaria and typhoid.
Yes, you can have the two.
Okay.
Thank you very much for that question. So one can have the two, actually. Now, talking about the pathophysiology, I didn't want to use that big word of how it affects the human body. Now, when these red blood cells get infected, and of course the liver cells, suffice also say that some of the parasites may become dormant and stay in the liver cells. For instance, for many months to many years, someone who is infected in this part of the world can travel to the US where malaria does not exist. Expectedly, the first 3 months, the person could have malaria along the line. But if the person stays beyond 3 months, the person may still have malaria after like 2, 3, 4, 5 years as a result of some of the parasites that may have remained dormant within the liver cells. That can happen. Now, when the blood cells are affected, the liver cells, the blood cells, the red blood cells that are affected will burst at a point and then spilling more of these rapidly multiplying parasites that will go on and on to spread to all other parts of the body. And the body system will try to combat, to fight back. What does it do? It tries to identify those infected red blood cells and then start the process of destroying them. In so doing, it depletes the red blood cells in the body, and of course, that will give rise to anemia, which is usually found in children under 5, people who have malaria, and of course, pregnant women. So malaria can give rise to shortage of blood because the blood cells are constantly, the infected blood cells are constantly being destroyed by the body itself in trying to combat the situation. Now, the organ of the body that does the destruction is the spleen. So it is not out of place that when you do abdominal ultrasound in this part of the world, in terms of investigation, now you can discover that a child may have an enlarged spleen. So when the spleen is doing this process, doing this work of destroying the infected red blood cells, it gets enlarged along the line. Okay, so there are some of the presentations that can happen. So in a pregnant woman, if the person is not treated fast, malaria can cause anemia in a pregnant woman. Malaria can cause a pregnant woman to give birth to low weight birth baby that will have smaller than usual or than normal weight. And it can also cause IUFD, intrauterine fetal death. So malaria is not something that anybody should toy with, even in pregnancy. And of course, that is why WHO recommends that there should be intermittent preventive treatment done for all pregnant mothers. The recommendation of WHO says about 2 to 3. So every pregnant woman must ensure that she gets treated in the course of the 9 months duration, that she gets treated. In this part of the world, I think usually we do it in the second trimester of pregnancy. When the woman has gone above the first 13 weeks, 16, 17, you can do that. And of course, we do it with a drug called sulfadozine pyrimethamine. Okay. Now, these are some of the presentations that we can have in malaria. In talking about this, we have dealt with the symptoms. We have also dealt with methods of transmission. Now, how is the diagnosis of malaria made? Okay, so that will be our next subtopic. Now, when you have an individual presenting with some of the symptoms we have mentioned, and as a clinician, you're thinking this person may have malaria, there are a number of things you can do. Number one is that blood film. You need to take samples for a number of tests for this individual. You need to take samples to do malaria tests, MP. We have the rapid diagnostic test that can give you results within minutes, within a space of 15 to 20 minutes. Okay, this can be quickly done in the lab. The idea of initiating treatment when a test has not been done for malaria should actually be discouraged, because in doing this, we have that has helped to give rise to having drug-resistant malaria in some communities. Okay, so apart from doing MP, you can also do full blood count or complete blood count, as it's called in some other parts of the world, to have an idea if this person's red blood cells has been depleted to anemic level. You want also to do blood chemistry. You want also to look at the liver functions, look at the kidney functions, if some of the organs of the body have been affected. Okay, so these are some of the tests that can be done. In some situations, it's not usually individualized. It may differ from one person to the other. There may be need to do an abdominal ultrasound, usually for children that are under 5 years of age. Okay, so that can also be done. Now, what about prevention? How can we prevent
malaria?
Yes, in our environment. Two major.
Doctor, please emphasize on having a clean environment. And this weather now, because I don't, you know, when you say it's like you're just blabbing, then they believe.
Yes, yes. Sanitation is key, because if you keep having pockets of water in and around your homes, if you keep having stagnant water, trees around our houses, all of these could be breeding ground for mosquitoes. You may be breeding mosquitoes that will, at the end of the day, will get back into your living room and, of course, deal a decisive blow. Not just you, yourself, and of course, your family members. Okay, so it's important that we know, we need to know that in trying to do prevention, we must maintain clean environment in and around us. Is important. Make sure you don't have any stagnant water. In some situations, in some places, I've seen people locally, if they feel they cannot afford to deal with the stagnant water around their homes, they will go and pour some engine oil, condemned engine oil on top of the water. That can help, because what that does is that it seals off, it floats. Usually oil will float on top of water. So it seals off the surface of the water. So whatever breathing that is going within, those microorganisms will be deprived of oxygen. That can work. That can work wonders. So if you can't...
I just gave you guys another formula.
No, I've seen it done. I've seen it done.
Another formula, oh.
That's why I haven't read it in any scientific journal, but I've seen it done. Yes, it can work. It can work. Okay, so these are some of the things that we are doing to help ourselves. But on a large scale, we can do two major things to control the vectors. They're called vector control. Okay, one is the large-scale use of ITN, insecticides-treated bed nets. Any community that can employ the use of ITN on a large scale will be able to bring down the population of mosquitoes in that environment. Okay, what it will do is that it has insecticidal effect. Any mosquito that gets close, that perches on it, dies. That's one. It could also provide you a physical barrier, in which case it prevents the mosquito from getting close to you. Okay, so populations that have used it on large scales have been found to control the influx of mosquitoes into such a community, and of course by extension prevent malaria infection.
Creams.
Now, another thing too that can be used in the course of vector control is the use of IRS, indoor residual spray. Okay. Now, these sprays can be used in large quantity, but the challenge is that the mosquitoes are beginning to be resistant to some of the components that are used in IRS.
Dr. Barth, why? When they know that they don't be human beings. Just like rats, when you put the gum book, they escape from that area. No, we'll see them again. So what's responsible
and
for
apart from that, wide use over years. Okay. And apart from that, these chemicals are not easy to come by. They cost good monies to procure them. Okay, but these are things that can be done in large scale. Okay. Now, beyond all that, what can we do to help ourselves individual? Let's get it closer to our home now. On a practical note, we need to ensure that our doors and windows in our living houses are screened with nets. Doors that will provide us with physical barrier. Okay, I've seen families that ensure that every night they must use mosquito fleet to ensure that all mosquitoes. Well, some of them these days, if you use some of them, after 1 or 2 hours, you see some mosquitoes darting about. Okay, so well, we don't have to go into all of that. Now, in terms of treatment, okay, because oftentimes we discover that people will come in and say, "Doctor, I have typhoid and malaria." I think a fortnight ago, somebody was asking what drug can he or she take to treat malaria. Now, when the diagnosis of malaria has been made,
Doctor, I'm sorry, can we say, can the same treatment be applied to typhoid? But let's take Rebecca from Lagos for. Hello, Rebecca. Turn down your volume. Rebecca, reduce your volume.
The volume of your TV set.
Yeah. Did they hear us?
Not the volume of your voice, so that of the TV set. Reduce it so that we can talk.
She
Okay, I've done that.
Okay, yeah, please go on.
Okay, good morning, doctor.
Good morning, Rebecca. Good to see you.
Yeah. Yes. Please, I have a very vital question to ask you.
Go ahead.
Okay. Apart from this, the normal signs and symptoms of malaria, you know, like the headache, vomiting, chills and rigors and all that. Once I have malaria, I pass through a kind of severe bone pain. That is from my waist down to my leg. The pains, they are very, very severe. That is, I won't be able to walk or do anything. Why is it like that? And it is usually from once I start my malaria treatment, you see the first and the second day, I can't walk.
Thank you very much. Thank you very much. Thank you very much. Now, a while ago, when I was trying to explain what happens when someone gets infected with malaria, I talked about the fact that the blood cells, the red blood cells precisely, that usually get infected by the parasites, okay, when they get into the human body, they become sticky. They become sticky, and of course, they match with each other. They get swollen. Some of them will get swollen and burst open and release rapidly multiplied parasites that will spread to some other parts of the body. Now, when they get sticky, and clogged up together, their passage, these are blood that ideally should be flowing within the vessels. By the vessels, I mean the arteries and the veins. Okay, that's what we refer to as vessels. Now, the smaller ones, the smaller arteries are called arterioles. They are so tiny that this clogged up red blood cells will have difficulty passing through them. And this is the picture. It's something similar to that happens in vaso-occlusive crisis in sickle cell. Okay, so when the blood gets clogged up and are unable to flow freely within the small arterioles that are usually found in joints, in the major joints of the body, it comes with some degree of pains. And so that is the reason why people who have malaria could have joint pains. Something similar to what happens in people who have sickle cell hemoglobinopathy challenges. Talking about sickle cell disease patients, they have VOC, vaso-occlusive crisis, which is similar to the explanation that I gave. That is what usually causes bone pains in some of them, alongside other factors, not in isolation though. Okay, so.
But doctor, please, why is it that malaria is attached to a particular blood group? I don't know. Because they'll say now AA, now they get malaria pass, now AS, now their sickness be this, but AA, if you never get malaria, that means you know be real AA. I don't know. Does it have anything? Does it have anything to do with the blood group?
Yes, it does. We can't shy away from that fact. We are not all affected to the same degree. Okay. Now, when we talk about the vulnerable population groups in the society, with respect to malaria, we are looking at under 5. Those are the scientifically proven ones. Children who are under the age of 5. We're also looking at pregnant women. We're also looking at non-immune migrants, people who are travelers who are coming into malaria endemic region from regions where malaria does not exist. Okay, so these are non-immune migrants. If they get bitten, they will have a worse outcome. Additionally, I also like to point out, before I answer that question, that frequent exposure that we usually have in this environment as adults will enable us to develop some degree of partial immunity. The immunity in this case is not lifelong. Partial immunity over years because of repeated exposure to malaria infection. And this partial immunity will enable us to ward off infection subsequently when we get bitten by infected mosquitoes. So the gist about some blood groups being able to ward off or being able to resist infection is actually true. Okay? So in rounding up, I would like to say 1 or 2 things with respect to treatment of malaria. The mainstay of treatment for malaria now is ACT, artemisinin combination therapy. And I'm happy that these are drugs that you don't need prescription to get. Okay, so you don't have excuses not to know what to do when you think you're infected. But keep in mind that I've advised that before you initiate the treatment, make sure that it is proven by way of test that you've been infected with malaria. Drugs like chloroquine, hydroxychloroquine, and a good number of them are no longer being used as first-line treatment because of the challenges of resistance.
Okay.
So on that note, that will be drawing the curtain today.
Yes, doctor, thank you very much. I'll see you guys 1 to 2. Join us again next week, Saturday. Bye.